Fighting the coronavirus is hard enough in developed countries like the United States and Western Europe. But as Nick Schifrin reports, in areas with active conflicts and large refugee populations, the problems are even harder and growing more dire.
Borders don't stop viruses, and pandemics don't stop war, and the victims of war have no protection. In northwest Syria, the war is older than the children. Pediatrician Omar Hamoud tries to ease his displaced patients' worries, but he's worried.
The truth is, if the illness spreads, it'll be very hard to contain. You see the way things are here in the camp? People are close to each other, one tent next to the other.
These Syrian refugees in Lebanon don't have space to practice social distancing. They don't have enough water to drink, let alone wash their hands. They don't have money to buy soap.
They gave us awareness sessions and 1 bar of soap each. But this is not enough. We ask for disinfectants, sanitizers for the camp. We ask the United Nations. We call upon the world to help us.
The world has 25 million refugees and 40 million internally displaced. Nowhere are they more vulnerable than war zones, where efforts to fight the virus are patchy. In Idlib, Syria, local workers hand out COVID-19 pamphlets, but the local medical leader tells PBS NewsHour there are only 200 intensive care beds for the entire region. In Yemen, women weave masks for what health officials call COVID-19's inevitable arrival, but half of all medical facilities aren't fully functional, and medicine, equipment, and testing are limited. In Libya, there's a state of emergency, and this cell phone video shows fire trucks on all sides spraying disinfectant. In Afghanistan, Ministry of Health workers disinfect government offices, but whole swaths of the country are left uncovered.
Welcome to this virtual press conference.
That helped inspire today's global ceasefire call by UN Secretary General Antonio Guterres.
Silence the guns, stop the artillery, end the airstrikes. This is crucial to help create corridors for life-saving aid, to open precious windows for diplomacy, to bring hope to places among the most vulnerable to COVID-19.
And to talk about this more, I'm joined by David Miliband, the President and CEO of the International Rescue Committee. Mr. Miliband, welcome back to the NewsHour. I'm isolated from the control room and from the studio. You're isolating at home. And I want to talk to you about a statement you made about how COVID-19 can thrive in war zones. Just how vulnerable are the refugees, are the internally displaced, are the people who are living in these countries where the healthcare systems have been broken by war?
Well, your excellent report showed exactly the challenge. It's tough enough to beat COVID when you've got the best public health systems in the world. We're talking about places where there isn't the hand washing facilities, there aren't the health facilities. And in northwest Syria, where you featured and where there are 400 International Rescue Committee staff working today, 85 health systems, 85 health facilities have been bombed by its own government and their Russian supporters. So you see that conflict is standing in the way of preventing a public health emergency. It's thanks to the NGO workers that are on the ground that we've got a fighting chance of using a bit of time to prevent the spread of the disease.
You've got a $30 million campaign out to try and help some of these people around the world suffering from COVID-19. But the disease not only threatens these countries that we're talking about, Syria and elsewhere, it's also threatening, as we've been discussing, places like the United States, places in the West that are usually the humanitarian givers, usually the humanitarian donors. How much of this is going to depress some of those donations and restrict humanitarian assistance?
Well, our argument is that it would be the utter folly to use this crisis as a moment to cut international aid. It makes far more sense to recognize that COVID-19 proves that we're an interconnected world and that the only way to stamp out this crisis is to treat it everywhere. We've got the gift of time in that most of the war zones of the world haven't yet been hit by the full force of COVID-19. And we need to use that time to install the hand washing stations, to make sure there is the triaging of people, to make sure that those who are showing temperature are separated, and to make sure that we get the information out by trusted people on the ground. That's what our $30 million appeal is designed to do. We've got 13,000 aid workers around the world and 17,000 volunteers who support them ready to spring into action. But we need that support to make sure that this disease is stamped out.
You're absolutely right. This is not universal across these war zones. Yemen, for example, doesn't have a single case, although officials there do expect cases to increase. We saw the UN Secretary General, Antonio Guterres, call for a global ceasefire. ISIS has suggested that its fighters shouldn't go to Europe. The European Union has said, don't send any weapons into Libya. Is there actually a chance for some of the violence across the world to decrease?
Well, the last time I came on this program, I bemoaned the crisis of diplomacy that was allowing civil wars to flourish, to extend in time, and to claim more civilian lives. This is the moment for the world to recognize that the unsolved problems of globalization, the unsolved problems of refugees, of war, of health systems that are not in place, it really need to be addressed. And at the moment, it's the NGOs, the non-governmental organizations that are on the front line trying to make a difference. Our call is that the world shouldn't just wake up to the problems immediately in front of it. The developed world has got to recognize that this is an international crisis and needs to be treated as such.
And Mr. Miliband, I only have about 30 seconds left, but I think this is vital, and you suggested it before, but let me just ask you again. So many Americans, so many people watching this are scared about their families, their communities, their country. What is your message to them about why they should care about these people thousands of miles away who are already so vulnerable?
I share the fears of all Americans who are worried about their own healthcare and their own health. But what I say to them is, remember that this country was built on a big heart, but also a sound head, straight thinking. And straight thinking tells you that this disease needs to be beaten everywhere if we're all to be safe. It's an appeal to head and to heart.
David Miliband, President and CEO of the International Rescue Committee, thank you very much.
Thank you very much indeed.